I'm Dr. Charles Rotolo from Total Orthopedics and Sports Medicine, and today I'm going to be talking about anterior cruciate ligament postoperative rehabilitation. After anterior cruciate ligament surgery, your quadricep muscle turns off and you have weakness, and so patients are placed in a brace. This brace is usually used for about 2 to 3 weeks, after which no brace is needed. Also, after surgery, patients are usually on crutches for the first 1 to 2 days, though I encourage patients to get off the crutches as soon as possible. And the reason for this is I want patients walking right away, I want them putting weight on their leg, and I want their quad muscle to return. Besides that, you're also going to be doing quadricep strengthening exercises early on, and as soon as your quadricep muscle is strong enough where you can hold up your leg, I get you out of the brace, which helps your knee to move better and helps you progress with your rehabilitation. The other goals of rehab in the first week is to get your leg to go completely straight, and the goal at the end of 2 weeks is to bend your knee to 110 degrees unless you've had a meniscus repaired, and when you have a meniscus repaired, I limit your knee flexion to only 90 degrees. I'm joined here today with Jack from Park Physical Therapy, who's going to help demonstrate some of the ACL rehab after surgery. He's wearing today a postoperative brace, which is a brace that I use for the first 2 to 3 weeks after surgery. The reason for this brace, again, is to lock the leg straight when you're walking, because your quad muscle turns off right after the surgery. The nice thing about this brace, it has drop locks, which are little locks on the side here, which you can unlock to bend your knee, which if you're trying to sit in a car or something like that, you can unlock, but then when you go to walk and stand up, you'll lock it straight and it's locked, and it helps support your leg. Nicole's joined us here today to help demonstrate to Jack how to do isometric quad strengthening. This is something that I start the first day out after surgery, again, to get that quad muscle firing again. The other goal in that first week is to get the leg straight, and this helps to also get the leg to go into full extension. Your goal at the end of the first week is for the leg to be completely straight and to have some quadricep control. The goal at the end of the second week is to bend 110 degrees, and she'll also demonstrate to him how to do heel slides, which is something that you can start working on that first week. But the first week your knee is swollen, it never bends that much, but that's something that you're really going to emphasize in your second week.
Okay, next we're going to do a quad set, which is an isometric exercise. You're going to be contracting your muscle without actually moving. So you're going to push your knee down, tighten your muscle here, and you're going to hold for 5 seconds. At home, you're going to do 4 sets of 20 of these exercises. Good. So that's the first exercise. The second exercise we're going to do is called the heel slide, and this is to increase your range of motion. So with this strap, at home you can use a towel or a sheet if you have it, and all you're going to do, leaving your knee down on the mat, you're going to bend your knee up using the strap to help you pull as far as you can to the point of pain, and then you're going to come back down slowly to full extension. You're also going to do 4 sets of 20 of this exercise.
So at the 2-week visit, one of the things I look for is to see how strong the quadricep muscle is. If the quadriceps muscle has recovered some and is strong enough to do a straight leg raise, then I'll get rid of the brace and let patients walk without the brace. So Jack, if you could lift your leg for me and show me one with a weak quadricep. So if the person can't lift their leg with their leg straight like this and they have a lag, then that person might stay in a brace for an extra week or 2 until they have good strength. But if they're able to lift their leg straight up, go ahead, like this, then that person's ready to get out of the brace, which I think helps a lot for their motion, because then they start walking with normal motion of their knee. From this point on, most of their rehab really has to do with closed chain quad strengthening and continuing to improve that quadricep strength. You know, your return to playing sports is usually at 4 to 6 months, when that muscle is at least 80% as strong as the other one. So for the next 2 months or so, everything else that you're doing really is closed chain quad strengthening, besides getting the very last bit of your motion, and until you get up to the 3rd month where you might start jogging. Closed chain quad strengthening is the next thing that I start for rehab after the first couple weeks when you get your quad strength. And the key to this is these are exercises where your foot is planted on the floor, and which decreases the stress on the ligament. So Jack today is going to help demonstrate some of these exercises.
Okay, so for a closed kinetic chain exercise on the wall, Jack is going to start with his foot planted on the ground. He's going to press his knee back into the ball and straighten his leg as much as possible while tightening his quad muscle. He's going to hold for 5 seconds, and he's going to do 4 sets of 20 of this exercise. Okay, for the next exercise, Jack's going to be doing a squat against the wall. Like the first exercise, his feet are going to be planted on the ground, and as he comes down into a squat position, he's going to bend from the knees and not the hips. Notice how his knees never pass his toes. He's going to do 4 sets of 20 of this exercise as well.
So at 3 months, if patients are progressing well with their quadricep strength and they don't have significant swelling in the knee, then they can start jogging. And if they do a month of jogging, at that point in time, there's a simple hop test that we do to see if they're strong enough to return to playing sports. Usually at that point in time as well, at 4 months or so, I'll also phase in some plyometric exercises as well.